So we recommend the diet therapy sooner than we ever did before. In general, if you look at sort of the expert consensus paper, if you look at most practice parameters and guidelines, they will say when epilepsy is intractable. Now, the definition of intractable changes. It can be one or two drugs and a sense that the epilepsy is just not getting better. So it might be even after one drug for a very specific form of epilepsy, Doza syndrome, Lennox-Gastaut syndrome, infantile spasms. You would say, you know, the diet really makes sense here. Let's try one drug. That doesn't work, we'll go straight to the diet. And so even at the first visit, we'll spend time talking to families about the drug, but say, in case it doesn't work, let's talk about some other options. And I think more and more centers are starting to move in that direction of saying it's not 5, 6 drugs. You know, let's think about it after 1 or maybe 2 drugs. And there are, again, as I mentioned, some of the conditions where we know the diet is so effective. Infantile spasms, GLUT1 deficiency, Doza syndrome, that many centers, growing numbers, are looking towards using it first. It's tricky. You have to deal sometimes with insurance companies that will deny the admission. They'll say the evidence would suggest after 2 drugs, and you want to try it after 0 drugs. This is something we're all struggling with. You can usually argue, there's enough papers that you can give to the insurance companies that say this is the gold standard treatment for this condition, that they approve it. And the families are thrilled. They love to try first. They appreciate that idea. They appreciate that concept. So we're moving there. It's slow going, the idea of using it first, but we're getting there. But I think, again, the majority of the children, it's 1 or 2 drugs. And then we at least bring it up. And some families, they're just not ready. They want to try a 3rd drug. They take a little bit of convincing, talking to other families. But usually after that 2nd or 3rd drug, they're ready.